Okay, now we will be testing the pronator teres. First, I'm going to palpate, so if you'll just turn your hand over. Okay. Test position is arm at side, elbow flexed about 70 degrees, forearm fully pronated. You stabilize holding the arm to the side. I am going to provide my resistance using the heel of my hand and my thenar eminence and my fingers to stabilize the wrist so that I do not pull her into extension. So if you'll hold there and don't let me turn your hand over. Hold, 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 and relax.
Now we're testing pronator quadratus. So first we're going to palpate. So I'm going to palpate here and ask you if you will turn your palm over please for me. Back and forth, forth, forth. Good. Now I'm going to have her do the whole motion. Okay, rotate in. Okay, so she has full range of motion. Okay. So we're going to put her in the test position, arm at the side, going to stabilize at the side here, fully pronated, fully flexed to take out the teres because that shortens the teres, it crosses the elbow. So we want to flex the elbow, shorten it, and make it less active so that we get the quadratus more. We're going to apply resistance. You're going to put your hand so that your thumb is kind of up in the hand coming through the web space, and you're going to be supporting the wrist and applying resistance into supination, okay? But supporting that wrist so that you're not cranking on it that way. You're just trying to give that type of resistance into supination. Okay? So on 3, I want you to try to hold your hand towards me. Don't let me untwist it. Okay? 1, 2, 3. Hold, 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 hold. And relax.
Okay, now we will test the supinator. We're going to do the test without the bicep. So first we're going to palpate. So if you can just try to turn your hand over that direction. Okay. Then go ahead and turn all the way over. All right, good. Test position is going to be shoulder flexed, elbow fully flexed, and forearm supinated. So I'm going to stabilize at the elbow with a pressure kind of pressing down to prevent any movement of the shoulder. My force is going to go here at the forearm, and I am trying to turn her hand towards her ear while she maintains this position. So don't let me turn your hand up, okay? All right, and hold, 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 and relax.
Now we're going to be testing the biceps and the brachialis together. First, we'll check that range of motion. Okay. And then we will palpate. Can you bring your palm up, please? Thank you. Good. Okay, and then the test position is arm at the side. You're going to stabilize at the elbow. The elbow is going to be at 90 degrees or a little less, and then fully supinated. You can do this position in supine as well, but I'm showing you sitting. So you're going to be in this position. You're going to hold your arm there. Don't let me push down. You're going to give resistance down into extension on the forearm. 1, 2, 3. Hold, 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 and relax.
Okay, now we are testing the brachioradialis. So first I'm going to palpate. So here, just press up into my hand. Okay, and relax. So do that motion again. Okay, so the test position is forearm neutral, so thumb up, elbow flex slightly less than 90. You're going to stabilize the elbow at the side there. My force is going on the distal forearm, pressing into extension. So hold there and don't let me press down. Hold, 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 relax.
Now we are testing the triceps. So first we're going to palpate. I'm going to put her in this position. I'm going to palpate the triceps and ask her to straighten her arm and relax. Okay, go all through the motion through here. Okay, straighten all the way up. Good. All right. Then we're going to put her in the test position, which is 90 degrees of shoulder flexion. The elbow is not quite fully extended. You're going to give stabilization on the anterior aspect of the arm, not here because you're going to be over top of the triceps. You're going to stabilize here. You're going to give resistance on the distal forearm into flexion. On 3, hold there. 1, 2, 3, hold, 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 and relax. All right, testing flexor carpi radialis. First, we're going to palpate the muscles, so we're going to have her flex and radially deviate, and then relax. Okay, we'll do that again. And she's tested the range of motion. So now we're going to provide support and stabilization underneath the forearm. You're going to have her flex and go into radial deviation. You're going to give resistance on the thenar eminence into extension and ulnar deviation. Hold this position. Don't let me pull your hand down. 1, 2, 3. Hold, 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 hold. That's it. Flexor carpi ulnaris. First, we're going to palpate, so we're going to have her flex and ulnarly deviate. We're going to palpate down near the ulna on the medial side. Okay, and we've just checked range of motion by doing that. I'm going to stabilize underneath the forearm, bring her up in that position again. Resistance on the hypothenar eminence, 5th metacarpal region. You're going to pull down into extension and radial deviation. Hold that position, please. 1, 2, 3. Hold, 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 and relax.
Okay, now we are going to test the extensor carpi radialis longus. So you want them sitting with their forearms supported on the table. You want their elbow flexed about 30 degrees, palm down. And so we're going to first palpate. So I'm just going to palpate right in here, and if you'll pull your head back like that, okay, and relax. So then I want you to pull your hand back and towards the side there, and then back down. So now I've got her range of motion. So the testing position, first of all, you're going to stabilize under the forearm here. Be sure not to squeeze. You're just stabilizing to prevent the forearm from moving or the elbow from coming up. The test position is into extension towards the radial side. Your pressure will go against the 2nd and 3rd metacarpals into flexion towards the ulnar side. Be sure that you're not just grasping. I use the pads in my fingers. So hold there, don't let me pull down. Hold, 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 and relax. Also, while we're here, I'll go ahead and show you the test for the extensor carpi radialis brevis. So same thing, you palpated it when you were doing the longest there. You want them fully flexed, so you will actually have to have them lean forward. Same stabilization under the forearm, and then same position here at the wrist. Extension towards the radial side with pressure against 2nd and 3rd metacarpals into flexion and towards the ulnar side. So hold. Don't let me pull down. Hold, 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 and relax.
Now we're doing the extensor carpi ulnaris. So the forearm is supported on the table. Okay, we're going to palpate first. So we're going to have the patient extend and ulnarly deviate. Okay, and relax and do that again. Good. So we palpated, do that again, and we check the motion. Okay, then we're going to have her hold that test position. Extended, ulnarly deviated. We're going to be supporting under the arm but not squeezing, okay? And then applying some resistance on the 5th metacarpal into flexion and radial deviation. Hold your wrist in that position, please. Your hand there. 1, 2, 3. Hold, 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 and relax. Testing the extensor pollicis longus. First, we're going to palpate, so I'm going to have her extend her thumb, palpate. Then for the test position, we're going to put her in neutral. We're going to give stabilization to the palmar surface of the 1st metacarpal and the proximal phalanx. That's so that we're supporting the CMC and the MCP joint. So we're going to stabilize there. We're going to have her extend her thumb, and then we're going to apply pressure down, okay? So hold, 1, 2, 3, and relax. And I'm applying pressure into flexion of the IP joint.
Okay, now we are testing the adductor digiti minimi. So first I'm going to palpate, and if you'll just bring your finger out like that, okay? You're going to have forearm resting on the table. You're going to grasp their hand. You've got to stabilize here. Your pressure is going to be against the middle phalanx, pressing into adduction, and you want to bring them into a slight abduction. So if you hold there, just using one finger, and don't let me press your finger in. Hold, 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 and relax.
Now we're going to go show manual muscle testing for the dorsal interossi of the hand. The dorsal interossi abduct the fingers, okay? There are 4. They're running from the metacarpals up to the proximal phalanx. So your first one's running like this, your second one's running here, your third one here, your fourth one here. So your first one is going to abduct your second finger that way. So if we were going to palpate, I would just have her bring her finger over, and that's checking her range of motion. Your second one is going to abduct the middle finger radially. So again, checking range of motion and palpating. Okay. The third one runs up like this. It's going to abduct the third finger that way. So note that the third finger has 2 dorsal interossi. It just abducts it this way and that way. The fourth one runs like this, and it's going to abduct the fourth finger. Okay, so we've palpated, we've checked range of motion of each of them. Now we're going to manual muscle test. So you have to just methodically go through each one of them. So we're going to stabilize the digits that are next to it. So if the first dorsal interossi abducts the second ray this direction, okay, we're going to put it in that position, and to manual muscle test it, we're going to apply resistance into adduction. So I'm going to ask her to hold her finger out like that. You're going to resist on the proximal phalanx. Hold, don't let me push your finger in. Okay, good. Okay, now if we test the second one, that's going to, as we said, abduct the middle finger that way. So we're going to put the middle finger into abduction towards the radial side, and we want to pull it and make it have to try to hold it in abduction. So I'm going to have her hold it to her second ray. Hold, and don't let me pull your middle finger away from your second finger. Hold. She's pretty good with that. Okay. The third one is going to abduct the middle finger ulnarly. So we're going to have her hold it to her fourth ray, and don't let me pull this direction. Okay, 1, 2, 3, hold, and she's really weak on that one. Okay, the fourth one is going to abduct the fourth ray this direction. So we're going to put her into abduction and have her hold it towards her pinky. Don't let me pull your fourth digit this way. 1, 2, 3, hold. Pretty weak there too. So that's how you would test all of those.